Millions of Americans can't access mental health care. Waitlists can last anywhere from a few days to 3 to 6 months. Insurance won't cover the cost, so they're turning to the next best thing, artificial intelligence. But what happens when your therapist is a chatbot? And what does that mean for the clinicians trying to care for them?
So I am seeing patients using AI tools in their personal life. And the way it usually comes up, it's happened in a lot of different ways. So one time I was interviewing a patient or visiting with a patient, and they brought out ChatGPT right when we were talking about their medication options. And they just asked ChatGPT in front of me what it thought about the medication I was offering. That was one example. Another time, and then kind of aside from that, I've gotten patients that have sent me my chart messages that would say, I asked ChatGPT about our plan and what's going on, and this is what it said, and then they'll give me a whole printout of their conversation with ChatGPT, and I'll read through it and talk about it with them usually. So in one instance, the patient wanted to talk about what medications they were on specifically and which ones we were thinking about using or switching to. And interestingly, the printout that they got from ChatGPT, it actually followed what we were currently doing. So I just told them, so in that case, it reinforced what we were doing. And so I told them, yeah, that's actually exactly what we're doing. And you're at this step right here. And if it doesn't work, we'll go on to the next one. And then I've had some patients who have a diagnosis that they may not particularly agree with, and they'll go to ChatGPT, and I've had them tell me, ChatGPT's known me for 2 years now, and it doesn't think I have schizophrenia. It thinks I have X, Y, or Z instead. And so we would have to have a conversation about, well, you are having these X, Y, or Z symptoms. I've also seen this, and your previous doctors have noted this, and then that opens up another conversation.
I do outpatient psychiatry, do inpatient psychiatry in a couple of hospitals, and I run a team in the community mental health team, serving the most sick folks in the community, severe and persistent mental illness, a lot of patients, schizophrenia, bipolar disorder. I say that because those are the folks that are primarily coming to me with these claims or statements, hey, I plugged this into ChatGPT, or I looked this up on AI, and this is what I've been told I need to talk to you about, or this is what it's telling me about my illness and my treatment. And kind of one of the things I've been talking about for a while when I talk to patients is these are individuals that at their baseline struggle with paranoia, sometimes looking for validation, just very ill at baseline and delusional. And they're putting stuff into an algorithm and getting an answer, and maybe having a preconceived notion of what they want the answer to be. So they're just coming to me with information which not always accurate, largely inaccurate at times, and it's thrown together. And to answer your question, yes, I've seen it a lot, and it's not always good. And there needs to be some asterisks next to the information that they attain in the context.
AI is not a hypothetical. Psychiatrists across the country are already fielding questions and misconceptions that patients have gathered from AI tools. For some patients, it's a supplement. For others, it's become a substitute.
Kind of both. I mean, there's some folks that I would say that are a bit higher functioning that might come to me and they say, hey, I was looking this up because I know we've chatted about this, and this is what the computer told me, or this is what ChatGPT has told me. And it might be based on a discussion we've had earlier or commentary we've had earlier. And it might supplement it, or it might add something to it, or maybe it's something that is new and brand new and quite useful to both of us. More often, it's actually deleterious, where information is kind of cherry picked and not always the context is not always understood.
Dr. Miller, who treats some of the most severely ill patients in his community, many living with schizophrenia and bipolar disorder, says he encounters AI-generated information several times a week.
I don't want you to think I'm in a clinic where people are coming in every session with AI information, it comes up like 3 times a week. So problematic, I would say, hard to tell, but certainly something where it's prominent and people are coming up randomly into a conversation and telling me, hey, this is what ChatGPT told me. What do you think? And it's kind of caught me off guard sometimes because sometimes it's people you wouldn't expect. Um, and it's becoming more prominent, I would say. And it's kind of forcing us in a good way to stay on our toes, to kind of make sure that we are aware that these technologies are out there. And sometimes they are sources of misinformation or incorrect information.
From an ethics standpoint, the surge in patients using AI for mental health support isn't just a clinical curiosity, it's a signal of a deeper systemic failure.
It's important that clinicians recognize that the prolific use of general purpose AI for psychotherapy is a sign that there just really isn't enough access to mental health care in general. And so people are turning to these tools because they can't get appointments with psychotherapists, or if they can, that their insurance policies don't cover the costs. So general purpose AI is a very easy, convenient solution when someone feels like they need to talk to someone.
But convenience has a cost. General-purpose AI platforms weren't built to function as mental health providers, and the gap between what patients expect and what these tools can safely deliver is significant.
The AI is pushing back suggestions about medications, about psychotherapy modalities, etc. It might cross that line.
That can be tricky, where I think anytime it's giving medical advice, that is where it is crossing over into clinical practice. But I do know that some will say, well, it's just like giving help in psychiatry or behavioral health, giving helpful advice that could come from a friend, it could come from anywhere. And so in psychiatry, it's that line can be kind of easily blurred. But it's really important for us to vet any kind of tool that's offering mental health advice, because it's important for that advice to be accurate and true and helpful and not harmful to people. So even though someone may say, well, it's just like a friend giving advice, sometimes friends can give bad advice. And so we want to make sure that if someone's using a tool or we're recommending a tool, that it is helpful and not harmful inadvertently.
There's a reason I went to medical school. There's a reason that residency is 4 years and training, and you have all this experience, because we need to put together the entire clinical picture. And I feel that it does not happen when you cherry pick the information that's AI derived. So my biggest concern is that patients are getting the information piecemeal and putting together to create a recipe or a puzzle that they like. And yet it's not really, the pieces are not appropriate, and there's a lot of context that's missing.
There's been an uptick in what's been called AI-induced psychosis. I don't really know what the evidence is saying about whether AI actually causes that or just triggers some latent psychosis. So I think that's something that's being studied. I think that there is the risk, again, of a patient or an individual having, dangerous thoughts and behaviors, and the AI doesn't actually respond correctly. The AI might actually offer suggestions for killing oneself. In fact, I mean, we've seen that already.
I've only seen it kind of impede care when it's like reinforcing someone's beliefs that aren't in alignment with their actual care. So, for instance, the example of a patient who didn't believe their diagnosis, even though we had sufficient and significant evidence to say they had this particular diagnosis, ChatGPT was convincing them and kind of reinforcing their belief that they didn't have that diagnosis. And so I've seen it's kind of like you go into ChatGPT with an idea or something that you want to hear, and it can amplify that.
Despite growing use, there is still no comprehensive regulatory framework governing AI in mental health care. No federal rules on age restrictions, no mandated crisis protocols, no required disclosures to patients about what these tools can and can't do. The FDA's Digital Health Advisory Committee held a meeting in November 2025 to discuss the growing use of generative AI-enabled mental health devices, including AI therapists. The committee highlighted the potential of using AI as therapists to expand access and personalize care, but raised concerns about safety, bias, and missed clinical cues. The committee emphasized the need for rigorous pre- and post-market evaluation, clear risk mitigation strategies, and careful regulation, especially for autonomous over-the-counter use and in pediatric populations, to ensure these tools are safe, effective, and appropriately scoped.
The guardrails that are in place for human-to-human therapy, where there is a duty to protect and warn in certain circumstances when the patient is presenting with thoughts and behaviors that seem to be imminently harmful to themselves or others, those are the things that need to be coded and designed for the AI platforms to be compliant with how we, in the real world, deal with matters of risk. Having regulations around safety for kids in particular is critical. And then the same goes for anyone with a mental illness who's using an AI to maybe for therapy or looking for advice, that they be like tested for being evidence-based and not prone to providing misinformation or information that might accelerate the individual's suicidal ideation or behavior, like giving advice on means, for example, which can happen if you prompt the AI the right way. You can actually get it to tell you methods of suicide. So, which should be, something that's impossible, right? In this context, if you're a scholar and you're like trying to study suicide or you're a suicidologist, that's different. But we need AIs to be able to distinguish between like requests for like scholarly information versus requests for someone who's really desperate and is looking for that information to use.
It's not all risk. Clinicians and ethicists alike see real promise for AI in psychiatry, particularly in documentation, screening, and extending access to care for patients who might otherwise go without. Studies have recently showed the promise of AI-assisted devices in psychiatry. For instance, OLIVE, a randomized, double-blind, placebo-controlled Phase 2b trial, evaluated BH200, nelavaptan, a selective vasopressin V1b receptor antagonist in patients with MDD. The study used HMNC Brain Health's proprietary genetic selection tool, which classifies patients based on biomarkers linked to vasopressin signaling and regulation of the hypothalamic pituitary adrenal HPA axis. Findings showed that lower peripheral vasopressin activity correlates with stronger central vasopressin activity in relevant brain areas, resulting in a more robust antidepressant response. This finding confirms that a genetic test can guide patient selection for BH200.
If you as a clinician can make a simple test and then get a result back that is either yes or no, and if it's a yes, the response would be, yes, this patient is very likely to respond well to the treatment, or the no means this patient is quite unlikely to have a good response. That is very helpful for me as a clinician, because then I can use the medication for the patients who had a yes response, and for the patients who had a no response, I need to look for some other avenue of treatment. So I think it will not help all patients, but it will help a subset of patients to achieve better efficacy than they get today. But it will actually also help the patients who are in the no group to not receive a treatment that is not helpful to them. So they will avoid a treatment that may not be beneficial for them. So I mean, we are at the forefront of this. We have two similar programs. I think in the future, this approach will probably be linked to other new medications that really can help clinicians to better guide the patients through the treatment of this disorder.
AI can also help detect depression. Dartmouth investigators developed the first smartphone application using artificial intelligence, AI, to detect the onset of depression, based solely on facial expressions. The app, Mood Capture, accurately diagnosed 75% of participants with early symptoms of depression in the clinical trial. AI scribes have also showed promise. In a study, the proportion of physicians reporting burnout dropped from 51.9% to 38.8% after just 1 month of using an AI-powered clinical documentation tool.
Certainly from our perspective, there is a lot of AI-generated software that's helping with documentation. I don't use it at this point, not because I am against it, because we don't support it in my current place of employment. I think that would be a great boon. There's been for years virtual secretaries or admins that can call people back. Those are, to a degree, I think AI derived as well. Again, positives, I think, is to streamline the workflow, make it more efficient.
I think, again, I think that AI can be used for all of these purposes with the right safety guardrails in place and with a human in the loop.
In my EMR, it has some generated insights for me. I may pay attention to it, but then ultimately I'll decide whether I want to incorporate it or not. Sometimes it may be helpful, sometimes it might slow me down. It just depends on what the issue is and what we're dealing with.
So what should clinicians actually do when a patient walks in with AI-generated advice? Experts say the approach starts with a familiar principle: meet patients where they are.
I always validate them and say, hey, thanks for bringing this to my attention. Thank you for sharing this with me. However, let's talk, or let's see what the entirety of the picture is.
Again, I do think that these platforms offer patients another outlet for processing emotions, and depending on the severity level, it might be perfectly appropriate that they're using the platform, or it might be helpful. So it really depends on the case. I mean, I think if a patient shows up and says, I've been using ChatGPT exclusively and it's told me everything I do is right and I'm not the problem, everybody else is, there's probably some counseling that needs to happen there. But I do think that when patients have experience with psychotherapy, with human to human psychotherapy, an AI agent could actually add a little bit of another perspective, because the patient really understands that it's a machine, has to, in contrast to human interactions. So I think it depends on the patient, depends on their diagnosis, its severity. That's how I would approach it if I were a clinician, and just come to it from a sort of non-judgmental perspective, recognizing these platforms are, offer a unique resource for some people who just don't have access to therapists. If a psychiatrist is working with a patient who is using AI, I think, the guiding principle to me in general is the principle of beneficence. This is one of the 4 principles of biomedical ethics, which is essentially a crystallization of the Hippocratic Oath to do no harm, to try to do good. And so the principle of beneficence, non-maleficence, these 2 complementary principles, I think, should guide everything that a psychiatrist and a physician does. And in this context of AI
is already in the exam room, whether clinicians invite it or not. The question is no longer whether patients will use these tools, it's whether the medical community, regulators, and technology companies will work together fast enough to make them safe. For now, the experts agree on one thing: the human element in psychiatric care isn't just valuable, it's irreplaceable.
I'm a human being, I'm a board-certified psychiatrist. I'd like people to have conversations with me, get to know me, I get to know them, obviously. And I think that's an important part of a therapeutic relationship, and that it can't be replaced by an AI-generated tool or algorithm. And that sometimes a human element is often important, especially in this field.